Hello, my name is Ludger Grote. I'm a pulmonary physician at the Sleep Disorders Clinic in the Sahlgrenska University Hospital in Gothenburg in Sweden. My personal interest is the diagnosis and treatment of patients with the variety of sleep disorders, but specifically sleep disorder breathing and cardiovascular dysfunction during sleep. Sleep deprivation is of course a major problem because it really affects our brain functions, and by that also our capability to perform our work most efficiently and without any major mistakes. So systematic sleep deficiency or sleep deprivation of course increases the risk for car accidents or for accidents at the work, which also of course impairs productivity at all. So it's very well known that sleep deprivation per se increases the risk of accidents, which in some cases really can cause a major loss of productivity in certain factories, or even doing damage to people, and in accidents that can hurt. So it's a major impact, of course. Yes, we have done specific studies on the impact of sleep disorders and sleep disorder breathing on public transporters, drivers, or other drivers. And what we really can see, and we performed studies, and one of my PhD students specifically looked on that. We did a study in more than 100 bus and tram drivers in the city of Gothenburg, and we found out that 35 of them had sleep disorder breathing with more than 15 pauses per hour of sleep, which we call significant sleep apnea. On those, we decided to treat 20 of them, and we actually managed to have a successful treatment in 15 out of them. We could document that the amount of alertness is much higher. And prior to our diagnostic procedure, they actually had 4 times higher accident rates compared to the other drivers who did not have a sleep apnea complaint. So altogether, it's a very clear indication that sleep apnea is a major problem for drivers and professional drivers, and particularly, of course, public transport drivers, because they often have a very, very tough scheme which disturbs the circadian rhythm. So I think a systematic assessment of sleep and sleep problem in those drivers is a good idea in order to prevent major damage and accidents and loss of life. It is well known that obesity is one of the main predisposing factor for obstructive sleep apnea. In individuals with a BMI above 30, we know that you must expect at least 50% suffering from sleep apnea. In particular, in severe obesity, the sleep apnea can turn out to be really life-threatening by inducing a lot of hypoxia, the so-called obesity hypoventilation syndrome, which has a very bad prognosis. So, of course, in countries with a high degree of obesity, the prevalence of sleep apnea is expected to be quite higher. There are, of course, different settings to get sleep apnea diagnosed. In every case, it is necessary to have a sleep recording, which means you have to record breathing and oxygenation or other measures during sleep in order to verify a diagnosis of sleep apnea, or to decide that this particular person has no sleep apnea. There are so many different test technologies available, and for instance in Sweden we very often use ambulatory devices. This means you can have devices given to an individual so that they can sleep at home with the device. You can even send devices by post to the individual, to the patient, and then they send it back. So there are very nice devices now available. It's a very nice development that industry has developed, of course, very good devices to record breathing during sleep. The first distinction for the devices is if you want to have a sleep EEG or not. So if you have polysomnography or so-called polygraphy. If the problem is that you have so many patients and limited amount of resources, at least we in Sweden decided to use polygraphy. And the usual devices, they have a respiratory flow over the nose, they have respiratory efforts over breast and chest, they have an oximeter to register oxygenation, they have an actigraphy to distinguish between sleep and wakefulness. And there are probably 10 different devices available on the market, and they are validated. It's very important that those devices are validated and that the software which run the analysis is also validated. Yeah, it's a really complex question. You know, that people really see sleep as a friend. It's a very important 1/3 of life. Needs, of course, a lot of information. So sleep usually for each individual it's a little bit like a black box. You don't know what's going on, and you only know if sleep is too short or if you lack sleep. You have a certain amount of problems. You're not alert. You probably get a little bit easy angry, or you probably have a little bit of loss of memory. So if you want to put this information, what is the role of sleep in life, to the general public, I think you really need some kind of awareness campaigns, and then you have to implement it in medical system as well. So I think you need to do really good studies. You need epidemiological studies where you ask people on the street how often they sleep, how sleepy they are, if they have accidents, if they are angry or not, to show the relevance for your people in your country. How does sleep affect quality of life, subjective sleep quality, sleep length, so that you can probably show that those people who have very short sleep or who feel unrefreshed sleep or who are very sleepy during the day, that they have a reduced quality of life. And at the same time, you have to show in your country that the modification of sleep behavior, so you increase the sleep lengths or you improve sleep quality, that this really, really improves people's quality of life, and on the long-term run, of course, reduces risk of accidents, reduces risk of psychiatric disorders, for instance. So it's a complex task to be performed step by step. And at least in Sweden, our people in Sweden, they want to have studies performed in our country. There's a lot of knowledge from the US or from Europe, but everyone wants to know it from their own country. So therefore, of course, I think it's very important that you start to do very good studies, which you can then transport the information about the importance of sleep to the people of Malaysia, of course. The use of internet and modern technology of iPhones and iPads, etc., per se influences sleep behavior, and probably in general it reduces sleep because you have more things to do and you have more light exposure. But on the other hand, those devices give you an excellent opportunity to record sleep length, sleep quality. And there are so many new developments where you look on actigraphy, you record the movements, you record your activity, and from those it's like watches that can really detect are you awake or are you doing asleep. And these technologies are really getting better and better and better. So I think modern technology like iPhones and probably associated sensors which can be connected to those smartphones can help to detect sleep-wake pattern and increase awareness. How many hours do I really sleep, and what is my sleep quality? Today there are many apps already available suggesting that they record your sleep quality. They give you very nice curves. They're actually quite well and probably quite good in detecting or separating resting activity versus waking activity. But they are not pretty well to describe sleep phases or depths of sleep or quality of sleep. But probably in 1 to 5 years, this gets better. So I really see a great future in this type of technology. But this can be very helpful to detect sleep disorders and sleep disorder breathing, for instance. So there are great chances in future, and some part of the future is already here today.